Hi, AMP Honors Program. I'm Riley, and for National Patient Experience Week, I decided to take the phone, take the chair outside, and talk a little bit about my personal experience as a patient. So for my experience, we are going to take it back to my senior year of high school, just a week before graduation, when a friend and I were lifting in our brand new state-of-the-art weight room that our high school just got, and we were squatting, and the bar started to slip off my back, and so my hands were going with it, going down, and I tried to get my hands out from under it, and the rack that catches the bar if it were to fall, like the supports, it caught my hand under the bar, in between the bar and the supports, and actually kind of like guillotined the top of my left ring finger right there. You can see that well. So I don't have that nail anymore. I still have the top knuckle, just barely. But anyways, that earned me a quick ambulance ride with the EMTs and the paramedics into the emergency room in Madison, which is the closest kind of big city to where I grew up. They were obviously the first medical professionals that I interacted with on this day, first of many. And there was an old lady and kind of a younger man that was a little bit older than me, and they both were very welcoming, and they were calming presence, I guess. I was in shock for most parts, so I wasn't really freaking out or anything, but still they just kind of kept my mind off of it all. And then when I got into the emergency room, I interacted with nurses and the emergency physicians, and then eventually the hand surgeon. And everything kind of just went really seamlessly, I thought. Everyone that I interacted with seemed very competent, and it was like they have one of these things kind of every day. And maybe the hand surgeon does, but I know that the nurses and the emergency physician probably doesn't. So that kind of reassured me throughout the whole process, just knowing that I was in good hands. For the hand surgery, they actually shot some anesthetics into my hand, just through the back here. Is like a 3-inch needle. This was the worst pain that I had. It was like just through the back of my hand, and then down that way, and then down like towards the lateral part of my hand. There was like a huge pool of like anesthetics in my palm, and I thought he was going through my palm. It was the worst. Once all that was over, about 5-10 minutes later, it all kind of like kicked in, and my whole hand was numb. And then I kind of just sat to the side, and we had all PPE on my hand, and he just really performed the cleanup right there in front of me, which was really cool. He talked to me through the whole thing. I mean, it was probably like 30 to 45 minute procedure. What he did was, and I'll throw some pictures up on the screen soon. I just want to give a forewarning that the first couple especially, but a lot of them are really graphic. So if you don't have a very strong stomach, maybe look away and just kind of listen to the video. But that'll be going up now, so just shield your eyes if you're not ready for that. So what he basically did for the surgery was he clipped the bone down, because the bone was kind of protruding past my skin level. He clipped the bone down, and that honestly felt like, it sounded like too, just like a fingernail clipping. And then once the bone was like low enough, you can kind of see the scar, I think. He cut down like a V into my skin, and then like flapped the skin over, and then stitched it kind of all the way around. So you can, I don't know if you can see that, but it was a cool thing, and he kind of talked me through it all. And at that time, while I was still in high school, I wasn't really sure where I was headed with my future, I guess. So this was kind of really my first big experience with a bunch of different medical professionals. And after that, I had, I think, 6 visits with a physical therapist who was just the best. And she was very supportive and super easygoing. And for my physical therapy, for the most part, was just kind of resensitization of the area, because it was all new skin. And so we started out with, there was kind of a grading scale of soft to more rough surfaces. So I think the softest was like a piece of felt. And so we started just kind of with felt, and we just kind of rubbed the area with it. And even that at first, since the skin was so sensitive, it kind of I wouldn't say it hurt, but it was uncomfortable. And just through the sessions, and I was supposed to do it at home too, but we kind of graduated to the higher and higher roughness scale. Eventually we got to sandpaper, which isn't pleasant for any finger, but it was definitely helpful in getting my finger back to playing shape, I guess you could say, because at that point I was planning on playing college football, and I eventually did that fall, so that was, I guess it was a successful physical therapy experience as well. So on top of all the physical therapy kind of things we had to do, I also had like a light cast and like a sleeve that I had to wear on my finger at all times, but we had to kind of unravel all the soft casting and then clean the area and then redress. And luckily we had a neighbor who was a nurse, so she came to do that. It initially started out twice a day, and then we weaned it off eventually, and I was able to kind of take over some of the load as well. So this patient experience was so influential on me and my pursuit into medicine that I touched on it in my personal statement, in my med school applications, and basically what I said was just that I was so impressed by all of the medical professionals that I interacted with on that day, from the EMTs and the paramedics to the nurses to the emergency physician to the surgeon and then to the physical therapist after that, and the neighbor nurse also, in helping redress and everything. And it was really cool to kind of see the inner workings of the medical profession and how easy they made that day for me and my family. It could have been a lot more traumatic, both that day and just leading on. I don't have any ill effects, I guess, of the amputation. I still play the piano pretty poorly. I still type relatively fast. One of my jobs is a medical scribe, so I'm still able to do that. I'm very thankful for all the medical professionals that helped me through that time, and not only me but also my parents as well, because my mom kind of took it pretty hard, and she was definitely worried about me. And the nurses and the physician and the surgeon, they all kind of talked with both my parents and helped ease their mind a little bit, I guess. Happy National Patient Experience Week. I hope you liked the couple images I threw up on the screen. And if you didn't look at them, I hope you enjoyed just listening to my voice. And I hope that in the future I can provide the same kind of patient experiences for my patients as my doctors did for me.